Welcome to Care Talk, where we talk about healthcare works or doesn't work in America and answer your health insurance and healthcare questions. Please text or call in your questions at 202-838-6837, and we'll answer them in a future episode. And be sure to subscribe to my channel or podcast wherever you get your podcasts. So today we're welcoming Dr. Ed Weisbart from Physicians from a National Health Program. He's going to be talking about the various nominees that President Trump has put forward to run healthcare in America. So welcome, Dr. Ed.
Hey, thanks. I appreciate you inviting me. Love your show.
Thanks. So let's start by talking about the top nominee, which is RFK Jr. to run the Department of Health and Human Services. So what can you tell us about his nomination and what's happening there?
So it's a frankly terrifying notion of having RFK Jr. as the head of Health and Human Services. It sounds like a bureaucratic name, but we have to understand this department that RFK Jr. would be in charge of if he gets through the process would mean that he oversees Medicare, he oversees Medicaid, he oversees the Centers for Disease Control, the Food and Drug Administration, the National Institutes for Health, Head Start. There's a huge section of the government that he would be overseeing, things that affect almost every American would be impacted by RFK Jr. So since this is sort of a premier health institution for for the country, and certainly in some ways for the rest of the world, it's really important to have one of our best and brightest people that really understands these sets of issues. And he's not that person. He's not that person. He has, frankly, dangerous views on public health. The things that he says are just frankly dangerous and have been shown to contribute to terrible health outcomes in some cases. He doesn't really have any understanding of the fundamentals of the programs that he would be in charge of. And in particular, during his recent hearing, it was really obvious that he doesn't understand the basics of Medicare and Medicaid, doesn't understand how they're different. He doesn't understand Medicare Advantage, any of the important parts of what he would be trying to lead to improve the health of the nation. He doesn't have that. And so, number one, that's terrifying to have somebody that unaware of things trying to run something. But you have to also understand that having somebody that with that little knowledge means that he would be perfect for the insurance industry to lobby and manipulate and redirect him. He's not going to be an advocate for the American people, although some of the things he says may sound like that. So he's pretty scary. Tomorrow's a big day for him. Tomorrow, Tuesday, February 4th, is likely the day at 10 o'clock when the Senate Finance Committee will vote on whether or not to move his confirmation forward to the full Senate. It's unclear whether he will or not. Could take odds on that. If he gets past the Senate Finance Committee, then he goes down to a full vote for a full Senate confirmation hearing, which could be potentially as soon as this Friday, February 7th. It's unclear if he would get through that. If he does, if they feel they have the votes to get through that, then he would be the head of Health and Human Services for our country. If they're not confident they have the vote, they could delay the vote for a few more days, trying to manipulate more senators to vote in his favor, or they could withdraw it. What they would do under that circumstance, it's anybody's guess. I'm not expert enough to give any guidance on that. But the key is he would be, if confirmed, he would be in charge of a broad swath of health and human services in the United States, knowing almost nothing about those programs. And my organization, we're particularly focused on Medicare and Medicaid, and he's demonstrated he doesn't understand that. So he would have to rely on people around him for guidance on that. And so, the next step, probably would be the hearings for Dr. Mehmet Oz as potentially the head of Centers for Medicare and Medicaid Services, or in other words, the head of Medicare and Medicaid. And that's perhaps more frightening to have RFK Jr. having to rely on Dr., so to speak, Oz for guidance on Medicare and Medicaid.
So, well, first of all, for everyone that's watching or listening at home, if you have an opinion about whether RFK Jr. should be put in charge of America's health, you should contact your senators because they will probably have a vote on RFK Jr. in the next few days. So please call, email, contact your senators and tell them what you think because they need to hear from you. And so, as you were talking about Medicare and Medicaid, let's talk about Dr. Oz, who is nominated to run the agency, CMS, which is underneath HHS. So, Dr. Oz would be working for RFK Jr. So, why are you concerned about Dr. Oz's nomination?
I suspect he has more understanding of the departments, which is in some ways less frightening and in some ways more frightening. His understanding of the departments means that he's announced his preference, his tendency, his bias towards turning all of Medicare from a great, imperfect but great public health program that is solely focused on improving the health of the nation. He's announced that he wants to turn that terrific program over to corporate raiders and plunderers. He wants to hand over Medicare to the for-profit insurance industry. And we know that that's incredibly bad idea. We know that that would actually bankrupt Medicare. We know that turning Medicare over to Medicare Advantage, which is what we're talking about, would shift the Medicare Hospital Insurance Trust Fund into deficit spending. It would bankrupt the program. It would add roughly $1.5 trillion onto Medicare's budget. So, the people often say let's rely on Medicare Advantage as a way to reduce the spending in Medicare, but actually it does the exact opposite. Medicare Advantage is funded perhaps $140 billion more per year than is a traditional Medicare. So it would bankrupt the program and it would harm people generally. It's amazing how much evidence there is of harm. People with some types of cancer in Medicare Advantage are literally twice as likely to die after surgery than people in traditional Medicare, because Medicare Advantage delays care. They make you wait longer to get your health care, and they typically get in the way when you want to go to see a premier, highly expert level of care. They say no. They direct you towards institutions that have far less experience. So the idea that Dr. Oz wants to turn Medicare over to this is terrifying. It would be dangerous for the country. We're focused on him because our organization, Physicians for a National Health Program, we're doctors. We're actually largely practicing physicians who have seen millions and millions of patients. I've seen tens of thousands. I mean, we are practicing real life physicians, and Dr. Oz is a practicing real life charlatan. He's a quack. He has a good pedigree in the past, but he has been so subverted by greed and the profit margins that he's hawked incredibly snake oil like things on the television for years. He's got these magic weight loss cures, green bean coffee extracts, saffron, red berry fat melters. He was one of the strong advocates for hydroxychloroquine for COVID, which we know has been shown to kill people. All of these things are things that, if somebody wants to have their own opinion on, they're welcome to having their own opinion. But, he's talking about being in charge of Medicare and Medicaid for the country. And I'm sorry, somebody that's in that kind of a role has to actually be science-based and not greed-based. All of those products that I just alluded to, that he's been promoting on TV, all of these are things that he has been personally invested in and was paid to hawk. He's said all kinds of things like that is just the opposite of what we would want for a healthcare system. He has personally tens of millions of dollars invested in healthcare systems and in pharmaceuticals and in big tech companies, all the parts of business that would be regulated by Centers for Medicare and Medicaid Services. So he could help or hinder the institutions that he would be in charge of. Johnson & Johnson, Bristol Myers Squibb, both manufacturers of drugs that Medicare is now negotiating the price of. So he would be invested in the organizations against which he is supposed to be negotiating on our behalf. He has hundreds of thousands of dollars invested just in United Healthcare. So when he's regulating United Healthcare, he would be doing that in a way to maximize the return on his own investments. He is not disavowed himself of that. He would be regulating groups like United Healthcare to maximize his own return on investment rather than actually improving health for all of us that need it.
So, people that are listening right now, if they are concerned about Dr. Oz and what he could do to Medicare and Medicaid, what can people be doing?
Two things. First, as you said earlier, call your senator, and tell them to stop this madness. But secondly, if you want to learn more and want to kind of be engaged in this, our organization, Physicians for a National Health Program, is going to be hosting what we call a shadow hearing. So an hour or two, maybe the day before Dr. Oz's actual Senate confirmation, we're going to be doing a shadow hearing with a bunch of physicians from our group and then a number of other folks, about an hour long. It'll be well produced, easy to watch, a little bit entertaining, but jam packed with information. So a shadow hearing, an hour or two ahead of the congressional hearing. And to find out about that, we don't know the date yet of the hearing, so we don't know the date and time of our shadow hearing. But if you go to pnhp.org, Physicians for a National Health Program, PNHP, or just Google Physicians for a National Health Program, go to pnhp.org. The landing page gives you a screen where you can then go to our shadow hearing and register for it. Or you can go directly to pnhp.org/shadow hearing. But if you register for that, then we will immediately send you the date and time and the YouTube link for when we have a date and time, which we don't yet because we don't know when the hearing is going to be. So go there and register, and we'll keep in touch with you. And then once we do have a date and time, that same web address will give you a link to the YouTube where it'll be broadcast live.
Mhm. And so we'll probably hear maybe a couple days or so before the hearing is scheduled. Is that right?
Yeah, sometimes we hear, a week in advance, or even a little bit more sometimes. So we might have fairly good advance notice. Sometimes we hear 48 hours in advance. So it's at the discretion of the Senate when they actually announce it and when it's going to be. But yeah, so stay tuned. And of course, if you register and you can't make it to the live event, we'll send you a link to the recording. So either way, you can get to see it. And this is really important. When something bad is going on, there's three things you can do about something bad in the country. The first, of course, is block the bad thing. That's going to be tough, but that's why we want to call senators. The second thing, if you can't block it, you should mitigate it. And that's, again, calling your senators can help with that. But if you can't block it and you can't mitigate it, at least document it. And it turns out that a lot of important laws got passed because groups that felt frustrated couldn't block the thing they were frustrated by, couldn't mitigate the thing, but they could document it. So documenting it, having these shadow hearings, exposing this problem, that is sometimes the best pathway to getting to a better place.
Mhm. And I'm not sure if you have the answer to this, but is there going to be a Senate hearing in a finance committee is going to be the ones voting on this? But do you know, is there going to be a health committee hearing, a courtesy hearing on Dr. Oz, just like there were two hearings for RFK Jr.?
I don't think they've announced that yet. It wouldn't surprise me either way.
Okay, so that also could be a thing if you are contacting your senators about RFK. You can also ask them, make sure to give a thorough hearing to any healthcare nominee that Trump puts forward, and make sure that they are operating in favor of public health as opposed to privatizing profits. So, Dr. Oz is a known charlatan, peddling supplements and other things to line his own pockets. Why do you think that he was nominated to run an agency that controls health insurance for millions of Americans through Medicare and Medicaid?
Well, it would be culturally consistent with all of the other pilfering and profiteering and privatization and destruction of the American government that we have going on throughout all of the last 2 weeks. It's exactly what we're seeing all over the government, finding ways to disassemble and destroy these programs that we have so carefully built. They're all imperfect. There's not a program I can point to that I would say is perfect, but oh my gosh, they're great. Oh my God, and Medicare, oh my gosh, it's rescued countless seniors from poverty. It's improved life expectancy for seniors. It reduces deaths among seniors. Medicare is terrific, as are so many other programs. Medicare is clearly imperfect. There's copays and deductibles and there's lots of things that need to be improved, but it's a great, great program, and it's just one of the many that the current administration seems hell-bent to destroy, to decapitate. Why they're doing it, I don't know, but Dr. Oz would be the perfect person to disassemble the program that has saved so many people's lives. And we can't let this happen.
Well, thank you very much for joining us today, Dr. Ed, and educating us on the dangers of Dr. Oz. And next, we are going to take viewer questions. So our first question is just to go over what has happened since our previous show a week ago. A lot has happened in the world of healthcare under the Trump administration. So we're just going to cover educating you and getting you up to speed on what happened and how it could affect you. So let's start by welcoming Diane from JustCare and Social Security Works. Diane Archer, can you just bring us up to speed with executive orders and tariffs and what's going on?
I'd love to. Thanks for the question, Laura. There's so much going on, so I'm just going to highlight a couple of the things. For one, tariffs on Canada and China will begin tomorrow, Tuesday, February 6th. And those will drive up the cost, Tuesday, February 4th, I should say, will drive up the cost of everyday items for everyday Americans. Trump has acknowledged people will feel pain. He has said that, and people will feel pain. He's right about that. Specifically on the healthcare front, Americans could see the price of their prescription medicines rise. We import ingredients for drugs from China, and that means pharmaceutical manufacturers will pay more to make your drugs and will clearly raise their prices so that they can continue to profit as much as possible from the drugs that you take. In addition, hospitals rely heavily on China for lots of their supplies, like gowns and masks and syringes. Apparently, it's 13% of the hospital budget is on supplies that are imported. And so, again, you're going to feel those costs likely in the form of higher health insurance premiums, no matter whether you're in Medicare or in a private commercial plan for working people. Your out-of-pocket costs and deductibles and copays will all likely rise with these tariffs in place. So that is of tremendous concern because, as we know, healthcare is already unaffordable to many Americans, and this is only going to make healthcare less affordable. As for Medicaid, the word is that Republicans in Congress are looking to slash more than a third of Medicaid's budget over the next 10 years, from about $600 billion a year down to $370 billion. We still don't know what will happen, whether they'll actually accomplish that. If you're opposed to those cuts, as we all should be, because they are Medicaid is a lifesaver for more than 70 million Americans, and then their families, we should be calling our members of Congress in the House and in the Senate to oppose those cuts. But we know that Republicans are looking to cut $500 billion a year in federal spending, and they have targeted Medicaid for nearly half of that amount. And with that, let me turn it over to Louise to talk about what has happened to marketplace coverage.
Thanks, Laura and Diane. Yes, and I second what Diane said about Medicaid funding. I do think that is squarely in the crosshairs as far as the federal government looking to cut funding to Medicaid. So definitely something for people to be paying attention to and contacting their lawmakers to talk about. As far as marketplace coverage goes, there have been no changes, and we haven't yet seen any proposed new rules, but that is something we are definitely watching in the coming months. We could see new proposed rules for short-term health insurance, for marketplace open enrollment periods, the family glitch fix that the IRS did a couple years ago, the low-income special enrollment period that lets low-income folks enroll all year round. These are all the sort of things that could certainly get changed. later this year as we're heading into the next open enrollment period, which starts in November. Also, health insurance companies that sell marketplace plans are right now working on their plans for 2026. They will start submitting, like the rates and the copays and all that is set for the year. It's set in stone. It doesn't change, but it changes every year on January 1st. And the rates, all those things start to get filed with state insurance commissioners in the spring. So here within the next couple of months, insurance companies will be filing their plans for 2026. And they will be incorporating things like, as Diane mentioned, if prescription drug costs go up, that will be incorporated into their filings. If the subsidy enhancements under the American Rescue Plan don't get extended, they fully expect fewer people to enroll next year. And of course, the people who won't enroll will be the healthy people. So that will drive premiums higher. These are all things that insurance companies are looking at right now in terms of the plans they're going to offer for 2026. So it's very much in a work in progress at this point.
Thanks, Louise. And our next question is from thyroid cancer survivor on Threads, who says that I was told by my pharmacy that my thyroid medication that I need to survive was declined again by my health insurance. I'm a stage 4 cancer patient who has no thyroid due to cancer, and I need to keep my recurrence stable. So, Louise, do you have some thoughts about what this person can do?
So your first step here should always be to talk with your doctor. It's possible there's another medication that would work that is covered by your health plan. And if it's a simple fix to just switch the prescription to the one that is covered, that's the easiest fix. But if not, if your doctor agrees that this particular medication is the only one that will work, then you need to utilize the appeals process. And almost all health plans, you have access to both an internal appeal, which means directly through the insurance company. And then if that fails, an external appeal where a third party gets involved. Oftentimes it's your state insurance commissioner. But your doctor is your partner in this. You work with them to submit the documentation that the insurance company needs to review the denial that they've put forth and see if they can approve it. If everything fails, patient assistance programs are offered by a lot of drug manufacturers. Eligibility varies from one manufacturer to another. It depends on your income and your situation. But these patient assistance programs can be used to make the prescriptions affordable when they would not otherwise be. And something we have discussed on this show before, where your mileage may vary, but some people do have success as a last resort going to either the media or their member of Congress. There's no official pathway for that. There's no guarantee it will work, but if you have exhausted your appeals options and there's no patient assistance program available to you, sometimes people do have a successful result when they take their issue to the media or call their member of Congress.
Mm-hmm. Thank you, Louise. And just if you are trying to contact your member of Congress now, you may have better luck contacting your local office rather than their office in Washington, D.C. It's my understanding that the Washington, D.C. offices are being flooded with calls due to all of the other things happening right now. So you may get a busy signal if you try the Washington, D.C. office, and you may be more likely to get through to a person if you call the local office closest to you. Our next question is from Inara from Facebook, who wants to know, what can we do now to see reform in healthcare? How can we get people to stop saying pursuing legislative changes for consumer protection is useless? Diane, give us some hope.
I am going to try, Laura, as hard as I can. So again, the most important thing we can do as Americans with representatives in Congress is to contact our representatives and speak to them about our need for good, affordable health care, good access to care. More than 80% of Americans strongly want good, affordable access to care. And they need to keep repeating that message over and over and over again to their representatives in Congress.
So, one thing I want to talk about is that there is hope on a state level. I have been down in Richmond, the Virginia capital, and a bill that has passed through the House and the Senate is limits on prior authorization, where you have to get you have to get your insurance company. You have to jump through hoops to be able to get access to the care that you need. So there has been some reform in Virginia in the past. Looks like there's going to be more reform to make it easier for patients to get the care they need. And in Illinois, the Healthcare Protection Act, bipartisan legislation, was passed and signed into law last year that, again, restricts what insurance companies can or can't provide you. So even if there is not a path right now for healthcare reform in Congress that would enable more people to have access to healthcare, and in fact, we are fighting to keep the gains that we've already made, you may have more luck focusing on the state if you want to make change and you want people to be able to get the healthcare they need and deserve. So take a look at what your state legislature is doing, and there may be more possibilities there for right now. Our next question is from Betty on Facebook that wants to know why no Medicare drug plan covers a particular drug, Armour thyroid. So Diane, any idea why none of the Medicare drug plans cover this particular drug?
So Medicare drug plans are private corporate plans run by for-profit insurers who want to design drug plans that best ensure that they maximize their profits. The government does require these plans to cover a range of different categories of drugs, but in most cases, not particular drugs. And so I am assuming that the reason why Armour thyroid is not in any of these drug plans formularies is because the cost of that drug is high and the insurer either believes it's too costly or it will drive up premiums and steer people away from their plan. So I would recommend a couple of things. One is sometimes insurers, Part D insurers, make exceptions if you don't have an alternative to that drug that will help you. So engage your doctor, talk to your doctor about writing your Part D, Medicare Part D insurer, and finding out what it is, whether it is possible to have an exception to their formulary in your case because you so need the drug.
And Louise has something to add about this.
Case, Armour thyroid is just no longer the standard of care. It's desiccated animal thyroid, and it's been around for a century. So it was actually grandfathered in when the FDA started to approve drugs many, many years ago. But they are changing that. By 2029, Armour thyroid will need to go through the regular FDA approval process in order to stay on the market. But for many years now, synthetic levothyroxine has been the standard of care for hypothyroidism. So that is, in this particular drug, that is the reason, is Part D plans do cover the synthetic version, but that's what most people with hypothyroidism are being prescribed now. The good news is Armour thyroid is not a particularly expensive drug if your plan won't cover it, but you can also probably switch to levothyroxine, which is covered by Part D plans.
Well, thank you very much, Louise. And I hope that helps the person that was looking for that particular drug. So thank you, everybody, for joining us today and learning more about Dr. Oz and other nominees. And please do contact your representatives if you have opinions about the people that will be running healthcare for America. Your representatives work for you. They need to hear from you on this and on any other healthcare issue. And please keep calling or texting in your questions at 202-838-6837 so we can answer them in a future episode. Join us next week for more. And be sure to subscribe or follow my channel or podcast wherever you get your podcasts. This is Care Talk.